Welcome everybody. Our talk today about pheochromocytoma. Pheochromocytoma, it is a tumor arise from the special gland in our body. We call it adrenal glands. So first, let us to talk about these adrenal glands. These are small glands located on top of the kidneys. Here it is shown by the yellow color, and it is responsible for releasing some hormones in our body, which these hormones help us to regulate the body immune system and to balance the salt and water in the bloodstream, and also it will help our body to respond to the stress. This glands it composed from two parts. The outer part we call it here, you can see here, we call it cortex, and the inner part here it is brown color, we call it medulla. This tumor we call it pheochromocytoma. It arises from the cells located in the inner part. We call it medulla. If the tumor occurs in these cells, we call it pheochromocytoma. In about 80 to 85%, this tumor arises from the inner part of the gland. We call it medulla. In about 15 to 20%, this tumor it can arise from outside of this gland. We call it extra-adrenal pheochromocytoma. So what symptoms we can found in this case, like headache, awareness of the heartbeat, sweating, shakiness in the hands, and feeling anxious, and high blood pressure. How to diagnose pheochromocytoma? We can diagnose by having some blood tests and imaging. But first, your doctor will examine you first, and then we will carry out some special tests, which include urine and blood and imaging. So let us start with the blood test. Blood test we are doing to see special hormones. We call it metanephrines and norepinephrines. Also, these two hormones can be checked in the urine by collecting urine over 24 hours, and then we can check the level of these two hormones, metanephrines and norepinephrines. Also, imaging can help us to localize and to help us to see the site and to the size of the tumors, and to check if this tumor is spread to other part of the body or not. And in most of the cases, the pheochromocytoma are benign and it is not cancer. And if it is a cancer, which occurs in the 10% of patients, it can spread. And what imaging we can do a scan to the tummy, which is abdominal scanning. Also, some more investigation can be done, more specific, MRI. Another test we call it scintigraphy and PET scan. Does pheochromocytoma runs in family? The answer is yes. In some cases, it can run in family. About 25 to 35% may be inherited. And there are some conditions that if it is inherited that we should rule it out. This condition called multiple endocrine neoplasia, von Hippel-Lindau syndrome, and neurofibromatosis. So additional studies can help us if we think that the case is familiar. So we can do a blood test, which is a genetic test, and to see if there is any mutation in a specific genes, and this can help us for the familial cases. We will think about familial cases if there is associated another symptoms of another disease of affection of other glands. For example, if we check the blood test and we found the parathyroid hormone level and calcium level high, so this means there is an affection of other gland. We call it parathyroid gland, a small gland in the neck. And if the two symptoms and the two diseases together, our case pheochromocytoma and this hyperparathyroidism, so we need to think about the inherited cause and particularly multiple endocrine neoplasia. Treatment. there are different doctors will be included in the treatment of pheochromocytoma, and the treatment options available are surgery and medication. The mainstay of the treatment is surgery, but before we go to the surgery, we need to control the blood pressure before we go to the surgery by starting some treatment. We call it phenoxybenzamine. So we need to start this medication, and after initiating this medicine, we can add another medicine. We call it beta blocker, and these two medications, it will help us to control your blood pressure before we start or we go for surgery. So the surgery is a treatment of choice, and it can usually cure the high blood pressure or hypertension, and it is used to remove the tumor from this gland, which we call it adrenal gland that I mentioned. Careful perioperative or before surgery treatment by controlling the blood pressure with alpha blocker and beta blocker, this medication, it is very important so as we can prevent complication during surgery, what we call it intraoperative hypertensive crisis. This means that the blood pressure, it can be elevated much if not well controlled before surgery. Another options, radiation and chemotherapy. These two options can be used in case that the possibility of cancer, and as we mentioned, 10% it can be a cancer. In this setting we can use radiation or chemotherapy.